So let's talk about treatment options for BPH. There's a wide range of them. Usually initially after you have a diagnosis of BPH, less invasive things are going to be tried first, like medications, specifically tamsulosin or something like finasteride or dutasteride. So those are medications that you would take on a daily basis. Those can help do things like relax the muscles in the bladder to help make it easier to urinate, or it blocks testosterone, which is what causes the enlargement of the prostate. Those are going to be more of the first line therapies. Once those are no longer providing a patient with the relief that they need, then we start looking at more invasive procedures, such as surgeries that are performed mostly by urologists. Typically, the thing that they're going to perform is called a TURP, or a transurethral retrograde prostatectomy, which means that they take a cystoscope or a camera and they advance that through the penis into the urethra, and then they go in and they shave out the enlarged portions of the prostate to restore flow through the urethra so you can urinate easier. Similar procedures are done through the exact same way, where they use that camera to go into the urethra. They can also do laser. Lasers usually reserved for prostates that are too big for TURP to be able to be performed. There is a steam-based treatment called Resume, which usually is going to involve multiple treatments based on the size of the prostate that you have, but also the amount of relief that you get with each treatment. So if you don't get quite the amount of relief that you need from it, then they'll go back in and they'll do it over and over again until you get what you need. There's also something called Urolift, where they go in and they put sutures or stitches into the prostate to squeeze it. It's a retention device that opens up the urethra as well. At ECCO, we perform prostate artery embolization, which is not a surgery. It doesn't, we don't have to go through the penis. We don't have to go into the urethra at all. We go through the blood vessels instead. So with all blood vessels, it doesn't matter. You can puncture the wrist and get to anywhere in the body because all arteries are connected. So if we're treating the prostate, we can do a needle puncture through the wrist, which causes minimal pain to a patient and a shorter recovery time. And then we can just navigate using X-ray and ultrasound guidance to get into the prostate arteries in the pelvis. Once we're in those arteries that are feeding the enlarged prostate, then we can deliver these small beads. They're barely visible with the naked eye, and we use a very small amount. A lot of people wonder how much we're using, and I would say it's going to be about a thimbleful or less. And what these beads do is they flow with the blood into the capillary beds that are providing the oxygen exchange for the enlarged prostate. Once those beads lodge in those capillary beds, it stops the oxygen exchange and allows or causes the prostate to shrink, which would thereby get rid of your symptoms. The success rates in PAE are up to 90%, meaning that up to 90% of men get complete resolution of symptoms after this procedure. That remaining 10% get a degree of improvement or no improvement. When you look at all of the prostate treatments combined, they are all very similar in success rates. They all range in that 85 to 95% success rate, with some patients not getting any relief no matter what. The beauty of prostate artery embolization compared to the other ones, there's no risk of impotence. The other ones all have a risk of sexual dysfunction following, and PAE is safe because we're going through the arteries rather than physically removing the tissue and potentially damaging nerves or other blood vessels close by.